So what are the criteria for diagnosing someone with MS? There are no symptoms, physical findings, or laboratory tests that by themselves help to determine if a patient has MS. Doctors use several strategies. So they take a careful medical history, perform a neurologic examination, and use various tests including MRIs, evoked potentials, and spinal fluid analysis. So MRI is currently the best imaging technology for detecting MS plaques or scarring, and it can differentiate old lesions from newer ones. A normal MRI, however, does not rule out the possibility of someone having MS. 5% of people who are confirmed to have MS do not initially have lesions on their MRIs. So in order to make a diagnosis, the doctor must find damage in at least 2 separate areas of the central nervous system, brain, spinal cord, or optic nerves. They have to find evidence that the damage occurred at least 1 month apart, and they also have to rule out all other possible diagnoses. So the second test is evoked potentials. So it basically is a test that measures the electrical activity of the brain in response to stimulation of specific sensory nerve pathways. So these tests are able to detect the slowing of electrical conduction that is caused by demyelination. It can help to confirm the diagnosis by allowing the physician to identify a second event that didn't cause any clinical symptoms or was otherwise not apparent. The final one is a cerebrospinal fluid analysis. So they take a little bit of the cerebrospinal fluid and they are looking for levels of certain immune system proteins. Research has shown that the presence of oligoclonal bands is found in patients that have MS, and these bands basically indicate an immune response within the central nervous system, and about 90 to 95% of people with MS are found to have these bands. The doctor will typically also conduct some blood tests to rule out diagnoses that may cause similar symptoms, such as Lyme's disease, collagen vascular diseases, and also AIDS.